Hi, I'm Dr. Ahmed Erekat, Dr. Cat for short, and welcome back to the Kid Fix Case of the Week Answered. After consulting with pediatric neurology, they recommended we admit the child for further workup, including a myasthenia gravis panel. Myasthenia gravis is an autoimmune disorder where your immune system blocks receptors between your muscles and nerves. It causes people to get tired easily, causes weakness, it causes droopy eyelids and double vision. Kind of like this kid. However, this child's myasthenia gravis panel came back negative or normal. During his admission, he also got an MRI and MRA of his brain, which is a more advanced radiology study that allows us to look at the structures and blood vessels in the brain. And that also came back normal. We specifically wanted to look at cranial nerve 3, which is the ocular motor nerve, which is responsible for 4 of the 6 muscles that move the eyeball, and responsible for the muscle that lifts the eyelid. But again, the MRI came back completely normal. He was then seen by pediatric ophthalmology, the eye surgeon, and it was this exam that revealed the diagnosis. They reported severe surface disease and concern for xerosis or xerophthalmia. They said there was no clear sign of ophthalmoplegia, which is paralysis or weakness of the eye muscles. And they commented that the ptosis, or droopiness of the eyelids, could be real versus reactive, and that they'd have to evaluate again once the eye surface was less painful. Xerophthalmia, or severe dryness of the outer layer of the eye, is pathognomonic with one diagnosis, and that is vitamin A deficiency. While admitted, he had many other labs checked, like his B vitamins. His vitamins B1, B12, vitamin E, and zinc were all normal. His vitamin B6 level was very low. His vitamin D level was also still very low. And his vitamin A level resulted almost undetectable. The normal range is 26 to 49 for his age group. To be complete, the rest of his eye exam showed bilateral ptosis, or bilateral droopiness of his eyelids. They said his conjunctiva, or the thin, clear, delicate mucous membrane that covers the white part of the eyes, was a little red, but they also reported Vito's spots over parts of the conjunctiva in the left eye. They also reported that his cornea, which is the completely clear dome-shaped front window of the eye that covers the pupil, and the colored part of the eye, the iris, had significant punctate erosions. So let's talk about vitamin A. Vitamin A cannot be synthesized by humans and must be ingested. It is one of 4 fat-soluble vitamins. Ancient Egyptians recognized that night blindness could be treated by liver consumption, and in the 1920s, vitamin A was isolated from the liver. Vitamin A is a subclass of compounds called retinoic acids, and there are 2 main forms, provitamin A and preformed vitamin A. Provitamin A can be found in plants, and then they are metabolized by mammals into vitamin A. Preformed vitamin A is also known as retinol or retinoic acid, and is found in mammal sources of food. Some common food sources for the preformed vitamin A are liver, kidney, egg yolk, and butter. Provitamin A can be found in green leafy vegetables, sweet potatoes, and carrots. You've probably heard of beta-carotene. So what does vitamin A actually do? It prevents xerophthalmia, or abnormalities in the corneal and conjunctival development. It's also responsible for phototransduction. So in our eye, we have photoreceptors called rods and cones. Rod cells detect motion and are responsible for night vision. In the rod cells of the retina, all trans retinal is converted to 11-cis retinal, which combines with a membrane-bound protein called opsin to yield something called rhodopsin. Rods don't work on their own, they're inert. Their type of nerve cell needs a chemical to enable their function. The body does not produce this chemical in daytime. It takes a very low light level sensed by the eyes to produce this chemical called rhodopsin. When the light is detected at a low level for 20 minutes or so, the body starts producing rhodopsin and night vision starts setting in. Vitamin A deficiency is rare in the United States. We often see it after bariatric surgery or weight loss surgery. However, there is a 30% prevalence in children under 5 worldwide and a 50% prevalence in children in South Asia and sub-Saharan Africa. We do see it here in cases of cystic fibrosis, celiac disease, cholestatic liver disease, primary biliary cholangitis, Crohn's disease, short bowel syndrome, and patients with limited diet due to mental health disorders. Like the patient in this case who was also diagnosed with an eating disorder, which was likely responsible for his failure to thrive, poor dentition, and vitamin A deficiency. Clinically, vitamin A deficiency causes xerophthalmia, which is a spectrum of eye disease, including pathological dryness of the conjunctiva and cornea caused by inadequate function of the lacrimal glands, or the glands that create tears. This can show up as Vito's spots, which are areas of abnormal squamous cell proliferation and keratinization of the conjunctiva, progressing into corneal xerosis and keratomalacia. So for our patient, his vitamins were replaced and eye symptoms improved within 1 month of discharge from the hospital. He received ongoing care for his eating disorder, which included the placement of an NG tube. So when your parents told you to eat carrots to help your vision, they were telling the truth. Carrots have provitamin A, which is necessary for your body to make rhodopsin, which you need for your night vision. Thanks for watching another episode of The Kid Fix. Make sure to like, share, subscribe, and follow for more cases like these.